So let's talk about neck lifts. I see a lot of patients don't really want to have a full facelift, but are much more targeted on the improvement of their neck and their jawline. So I describe usually two different types of neck lifts that we can perform on our patients, and it really just depends on what their goals are as to which neck lift procedure we decide to do. The first is a more isolated neck lift, which is really just going to improve the neck itself. It's not going to target any of the jawline or any of the lower face. That often is done with an incision just behind the ear and then a small incision underneath the chin. And through that, we can help lift and suspend that neck skin and tighten up the deep muscles, which will allow us to get a nice contour from the jawline to the neck. We will also address any fat issues that we may have in that area. Now, in patients that tend to have a little bit more distortion along their jawline, maybe a little bit more prominent jowl, or a little bit of downturning of the corners of their mouths, we can do kind of a lower face or a higher neck lift, which is also going to tighten that jawline and improve those corners just a little bit. That does require us to move our incision a little bit towards the front, but we're still not going to do anything to the cheek. So those operations take us anywhere between 2 and 3 hours. They're usually done as a day surgery. Afterwards, you'll have some stitches that will come out at around a week or so. We also put a drain tube in. When we lift up that skin, we create space. We need that skin to stick back down. So that drain tube is necessary to prevent fluid collections underneath the skin and allow that adherence. And those drains often stay in about 3 to 4 days. They're really easy to take care of. Usually you just have to empty them once a day, and that's something that we can go over with you on the day of surgery or even beforehand. Most patients don't have a lot of pain after surgery. They do say their neck feels tight. It's not suffocating tightness, but it is a little bit tighter, and that's from the work that we did underneath the skin, which will allow you again to have a more longer lasting result. From an activity standpoint, if you're doing really well at 2 weeks, I'll let you slowly start to increase your activities, but it may be 4 to 6 weeks until you get back doing all the things that you want to do. As far as risks of the surgery, anytime we do surgery, there's risks for bleeding and infection. Fortunately, very rare in these procedures. This is a little bit of a trade-off. We're going to put some scars in some discrete areas. Fortunately, these scars tend to heal really well, and once those sutures come out, we can do a little camouflage as they're kind of in that healing or maturation phase. Usually by 2 to 3 months, they're very difficult to even see. You will get some numbness in the areas that we operate. That can take anywhere between 3 and 6 months to completely resolve, but it does resolve. There are some important blood vessels and nerves that are deep to where we're going to be working. We just have to recognize that they're there. Fortunately, the risk is very low for these types of injuries. The ideal patient seeking a neck lift has maybe some disharmonious aging between the upper part of their face and the lower part of their face, or a patient who's really just wants some subtle improvement in their neck and not overly concerned about their cheeks or even their eyes. We do often combine neck lift with other procedures. Sometimes we do it with eyelid surgery. Sometimes we do it with augmentation of the face with facial fat. There's a lot of different things that we can do at the same time as we consider a neck lift. You know, our job isn't to necessarily change your appearance. We just want to turn back the hands of time. Often performing a neck lift on patients allows them to be more comfortable in their own appearance. So let's review the quick facts for neck lifts. These operations take us 2 to 3 hours. They can either be done under sedation or under general anesthesia, and that's a decision that you can make with our anesthesiologist. These are done as an outpatient, which means you will go home that day. You'll have a little chin strap on, which is a little external support that you'll wear for much of that first week and about half the time for your second week. When we do a neck lift, we are going to have some surgical incisions that are going to take a little bit of time to heal. There's always a small chance that you can get some bruising. Fortunately, that's pretty unusual, and if it is, it's pretty much down on the lower part of the neck. We don't typically see a lot of swelling associated with this, which allows our patients to get back into public, usually within the first 7 to 10 days. As far as risks of the procedure, we discuss bleeding and infection. You're going to get some numbness from the procedure. We're all a little asymmetric. One side's a little bit different than the other, and those may persist to some degree even after the surgery. There are some important blood vessels and nerves that are deep to where we're going to be working, so there's always a small chance that you could have some temporary weakness. I'm often asked, how long will a neck lift last me? And it really just depends on each specific patient. A lot depends on the quality of skin and how much excess skin you have. If you have really good skin, you don't have a great degree of skin redundancy, then that procedure should last you 10 years plus. But if you have a fair amount of extra skin here and the skin is really thin and you've had a lot of sun damage, there's a chance that you can get a little bit of recurrence early on. Those patients sometimes come back at a year, and we just do a small little operation in the office to try to eliminate that recurrence. I'm often asked, well, when can I go back out in public? I think the nice thing about neck lifts is there's not a lot of swelling associated with it. Many of my patients are back in public by 6 or 7 days. We usually say you can go to your third favorite restaurant on the 7th day and maybe not make it to that favorite restaurant until about 2 to 3 weeks afterwards.